Hello and welcome back to the Dr. Vincent Buscemi podcast, General Dentist, just out here trying to make you healthy. So I've skipped a week of podcasting because I've been really busy implementing the systems in my office to get my orthopedic part of the practice up and running. If you've been listening for a while, I'm training under Dr. Felix Liao, and I'm now implementing the systems to take on patients to do the airway doctor mouth training or the jaw orthopedics training where we expand the maxilla, and that's for a whole different podcast. The more you dive into maxilla expansion, everybody has their own way of doing it. Everybody says everybody who does it differently is doing it wrong. Everyone says that if you do it this way, you're causing pain. If you do it this way, you're causing harm. It's a whole deal. So before we dive into this, I'll tell you, if you're an oral surgeon, you pretty much think everything but doing surgery works. If you're an orthodontist, you think any general dentist that does any form of expansion is an idiot. And if you're a general dentist like me, you're just trying to do your best. So we will do another podcast on maxillary expansion, but the more I dive into maxillary expansion, the health benefits, it reminds me when 10, 15 years ago, I was diving into health and nutrition, and I came across the idea and evidence that saturated fats are not bad for you. And then I told someone that, and then that person told me they hated me. And that person was a medical student at University of Michigan. And then so quick story. I joined this group of multidisciplinarian healthcare, whatever, at University of Michigan, where the pharmacy school, the dental school, the medical school, the school of public health all got together monthly to discuss something. And I was on this email chain, and on the email chain, they had vegan Mondays. And then I sent an article out how long-term, and if you're a vegan listening, I don't want you to leave my podcast, but this is what happened. I sent an article out about long-term veganism and lack of nutrition and how grass-fed meat long-term is healthy for you. And they kicked me out of the group. So that's what is happening with maxilla expansion. There are so many opinions on it. Of course, I picked the one thing in dentistry that everyone has an opinion and everyone's ready to sue or report you to the board. But I'm here to find the truth. Okay. That segues into, I think, the whole sleep apnea, orthodontic expansion, sleep apnea, maxillary expansion is missing the point. And I think this is why Dr. Felix Liao left a really big company that was doing appliances and branched off on his own because he saw the truth in this. And the truth rests in the idea of form leads to function. So the better the form of your body, the better it functions. The more aligned you are, the better your body functions. This is less mainstream traditional medicine and really leans more towards chiropractic and getting your spine in a neutral position. And that will have either positive downstream effects in your body or negative. So I want you to look at the type of jaw orthopedics that I supply in my practice, not as a solution, a one-stop solution to sleep apnea. Although if your tongue is trapped and we do some maxillary expansion, or we'll say dental alveolar expansion, and it frees your tongue, it can reduce your sleep apnea symptoms. I had a patient reach out after last podcast, very sweet lady, really cares about her kids, asked if what I did was a cure to sleep apnea, and it's not. I'm not a physician. I can't cure sleep apnea. But if you open up the oral cavity through these devices and it frees your tongue and the tongue is one of the reasons why you have sleep apnea, then yes, this will reduce your sleep apnea. There is a doctor on YouTube, Dylan, I think Petus, Petus, I have to look up the name, where he talks about the true causes of sleep apnea. And I'm going to kind of go through his research and maybe even see if he wants to be on the podcast. But it's not just the collapsing of the airway from a small mouth. So there's other issues as well. A lot of it has to do with weight. And I hate to bring this up, but one of my favorite Disney movies is WALL-E. And if you're watching my YouTube, you can see this. Unfortunately, we are all headed this direction. We are. And I don't say this through a condescending manner, like, oh, I'm better than you, because I eat junk food too. I get poor sleep. Last week, I got less than 6 hours every night. I stress. I don't live the most healthy lifestyle, but I've been a dentist for 11 years. I was in school for 4. 15 years of seeing people. Our health is declining rapidly, and it's scary. And the reason why it's important to me, because now that I have young kids, I want to have the knowledge to obtain health so my kids can be healthy. So from the perspective of today's podcast, I want to go over this article published in some Indian journal. And I will say this article is not the most scientific of scientific articles. There's no long-term following of patients. There's no meta-analysis. There's no systematic review. They talk about one patient and don't even show pictures. They show one picture of one person and they don't even say like what they did to fix the patient. But the actual theme of the article, how posture, occlusion, and airway are all connected. And it says right here on the screen, obstructive sleep apnea syndrome is one of the compromised airway is found to be a major contributory factor in sleep apnea cases. Restoring the dental anatomy to its normal has been found to reduce load on the spine, improving one's posture. It also facilitates the compromised airways to attain normalcy. So, what this article is talking about is that a neutral spine is the foundation of health. And one of the easiest ways to throw off a neutral spine is the dental bite. And when the dental bite or occlusion is off, it can compromise the airway, and then that promotes unhealthy breathing. So let's run through the PowerPoint here. So if you're a chiropractor, you're going to love this podcast. Or if you're a patient that sees a chiropractor, you're going to love this. Unless I'm totally wrong about all the chiropractic terms, what is a neutral spine? In this article, it talks about the foundation of your body's design, the spine. If the spine is off, there's a downstream cascade of negative health consequences. And I believe this. I've always thought this dental occlusion alignment is more in terms of whole body alignment than just sleep apnea. So a neutral spine or a healthy spine is 3 natural curves. You can see the kind of artist rendition of a spine here on the left. In the cervical portion, thoracic portion, and lumbar portion. And when your bite is off, it throws off these 3 natural curves. When the spine is neutral, it has even weight distribution, allows you to breathe better. There's less muscle tension, less strain in your joints. And this is not something you scientifically can test, but you physically and can empirically feel this. You will expend less energy if your body's form is optimized. Just think of someone in your life who has terrible posture or just their body is way off. Have you ever seen them like walk from their car to the front door of someone's house? It's like you're worried that they're even going to make it there. Granted, at the time, my dad's dad, my grandfather, was probably 95, but I thought he was going to pass away from walking from our driveway to my parents' front door. And some people feel that way at 40. I just talked to someone yesterday who's 50, and he's about to have his second knee replaced. He says he feels like he is 80. And nobody wants to feel that way. And I wonder if fixing your dental occlusion can help you feel younger. And that's not a medical claim. I should have said this earlier. There are no medical claims in this podcast, just entertainment. So, when the natural spine curves are off, you have hormone imbalance, digestive issues, reduced oxygen intake, all your cellular energy is thrown off. So this is premise one, the occlusion posture connection. First molars are the foundation. So there's some guy named Engel who created a molar classification, I think in the late 1800s, where basically there are 3 dental bites. There's a class 1 bite, which is the most aligned, where your upper and lower molars are aligned. There's a class 2 bite, where your upper molars are ahead or forward of your lower molars, and that can create forward head posture, which everyone seems to have. And there's a class 3 bite, which is less common, which your upper jaw is farther back than your lower jaw. So most of us have actually a class 2 bite, at least in my experience. And every time you have a class 2 bite, you have a more prone tendency to have a forward head posture. And also looking at your phone all day is going to give you a forward head posture. If you look at this graphic down here, every inch your head is forward adds 4 to 5 kilograms, which I think is 8 to 10 pounds on your spine. And that will cause more spinal problems, neck pain, TMJ dysfunction. Your gait could be off. We talked about balance and bite as well, more shoulder tension, and scoliosis risk. So the more forward head posture you have, which is linked to male occlusion, can cause more pressure on your spine, which can cause more problems. So right here, your jaw position affects the entire body alignment. What seems dental often has whole body implications. So if you think about it this way, if the spine, a neutral spine, is one of the core things you need for health, one of the things that can throw off the spine is dental malocclusion. So is the spine important? Yes. But if you only get chiropractic adjustments and don't fix what's causing your spine to be thrown off, which could be a bad bite, you'll never get healthier. Next is, this is where sleep apnea comes in with dental occlusion. The more forward head posture you have, the more it compresses your airway. And airway is a generic term for all the oral space in your mouth, behind your nose, and your neck where the oxygen goes through. So airway is not a medical term. It's a generic term that describes 4 or 5 spaces behind your mouth and your throat and your nose where air goes through. But forward head posture will reduce nasal breathing and increase mouth breathing. And we've gone over this thousands of times, but nasal breathing is the way to go. When you breathe through your nose, you get nitric oxide, which improves your blood pressure. You have antimicrobial activity. You can have more vasodilation for the nitric oxide. And then you have reduced cortisol. And then this article even states weight gain, but that's probably from increased cortisol, increased stress, weight gain. So forward head posture increases the chances of mouth breathing, which destroys your health. Let's run through this in a logical fashion. Premise 1, proper jaw alignment ensures a neutral spine, which is the core or crux to your health. Premise 2, a neutral spine supports efficient posture, which allows you to expend less energy just to stand, and increases nasal breathing over mouth breathing. And then efficient respiration or breathing regulates energy, emotion, and healing. So this is the non-scientific case they bring up, because they just explain they treated this lady's malocclusion and she got healthier. But this lady had forward head posture of 15 degrees. She had an airway width of 6 millimeters. She had moderate sleep apnea, visible neck folds, cervical kyphosis, chronic fatigue, all because her dental occlusion was off, which threw her spine off, which compressed her airway. They fixed her occlusion. They brought her forward head posture back to 5 degrees. It increased her airway, doubled it. They neutralized the spine, and she had increased energy levels. And you see this a lot in patients that do get a occlusal improvement from these oral devices. So I think we have to go back to the Bible, which I just lost half my patients. But if you think about the way the body was designed, if you think about if God is real or if he's not and it's just evolution, the body was designed a perfect way. And it was designed for a purpose. And the form that we live now, the form of our body, is different than the form that it was designed to have, the more dysfunction we have. So I want you to think about your bite, your spine, your body, and how all of that used to be designed either by a creator or by evolution. And the way we are living now is more like that first slide I showed you, those people in the movie WALL-E. We have gone so far from our original design, which is causing all of these health problems. And I know this to be true because I see so many people that are complaining of so many health problems. And when you have health problems, your only wish is to have less health problems. And I think a lot of it has to do with if you can get your dental occlusion correct. And that can cause you to have a neutral spine. And then your neutral spine can increase or have downstream positive health effects. So key takeaway, everything is connected. If you don't believe that, this is not the podcast for you, but your jaw, your spine, your breathing, they all work together. They all are one system. Misaligned teeth can throw off your spine and move you from a neutral spine to a problematic spine. And when you have a problematic spine or a non-neutral spine, you get forward head posture, which not only increases the strain on the rest of your body, it causes you to expend more energy just to stand up. Your forward head posture, remember, every inch you go forward is 8 or 10 pounds more on your spine. Neck pain, TMJ, muscle pain. Forward head posture also reduces your ability to breathe through your nose naturally. And when you don't breathe through your nose and you breathe through your mouth, it's less oxygen, less healthy. So all of this is related. What can you do to fix this? I think you have to take a holistic approach on your body. If we go back to that picture of WALL-E, and I don't mean to stress this over and over and over, but if you look like that, we have to get healthy. I think step one, you get a doctor involved, a medical doctor, and see ways where you can get your metabolic health back in order. You see a chiropractor to align your spine, and you see a dentist who is trained in occlusion and understands the connection between occlusion and a neutral spine, and that's your first step. So I really appreciate you guys listening. Tune in next time, and I'll see you guys soon. Bye.